Now moving on to our last section, we will be briefly discussing the implant material sciences. We will be discussing what are the metal implants, what are the failure and what is the reason for the corrosion, what is friction and wear, why we need to use ultra high molecular weight polyethylene, especially what is metal on metal prosthesis and metal on polyprosthesis. So with advent of total hip and total knee replacements, this implant science is actually there is a boom in implant science, especially over the last decade or so, because we are using different types of implants, especially the different types of metals actually being used for a joint replacement surgery. An ideal implant should be tough, it should be strong, and it should be non-corrosive, biologically inert and easy to sterilize. So this is a kind of a properties of an ideal implant, but not every implant is an ideal implant. Every implant, for example, using stainless steel, titanium or cobalt, chrome, it has its own pros and cons, and we need to remember that what are the different pros and cons of an implant we are using for total knee or total hip replacements. Materials usually utilized are stainless steel, which is a 316L form, which does not contains cobalt, but it contains other the elements such as chromium, nickel, molybdenum, iron, and other forms ore as well. Then it could be a cobalt chrome alloys, which is actually a very strong and stiffer alloy, but then again it has its own pros and cons, because although it's stiff and durable, but then it produces it undergoes cracking and it produces squeaking sound, which is then again problematic for the patients in the hip joint replacements. Then there are titanium alloys as well. Although titanium implants are being used, but then again they are not as stiff as compared to stainless steel or cobalt and chrome. Then they undergo bending properties as well as corrosion as well. So there is no ideal implant, but here every implant has its own pros and cons. You have to remember that. So coming to the stainless steel, this is actually can be cold worked and form. The used form is actually 316L form, which contains carbon, chromium, iron, nickel, molybdenum, and many other elements as well. But it does not contain cobalt. It's highly ductile, that is, it can be drawn well into the shapes. Then other is the cobalt chromium based alloys, which actually contains cobalt. This can be used for total hip replacements, but chromium is added to the cobalt by passivization. Passivization is basically a method in which a layer of oxide is formed around the metal so that it does not actually undergoes corrosion early. Therefore, actually it's biocompatible in human, is very good, and it can be used in total hip replacements. But then the problem is that it's a very good implant as far as toughness and strength is concerned. But once it does not undergo wear, but it can undergo cracking and leads to a squeaking sound, which is usually seen in the patient who have gone under the cobalt chromium joint replacement hip surgery. Then coming to titanium alloys, it can be used in fracture fixation devices and joint prosthesis as well. The disadvantage is the notch sensitivity and can reduce fatigue life, but usually they are not as strong as compared to stainless steel and cobalt chromium. So therefore we have to make a kind of a compromise that, okay, we want this patient, we need this kind of an implant in this patient. Now coming to the implant failure. Implant failure could be for many other reasons. It could be due to defects during the manufacture, although it's nowadays strict guidelines are being used to manufacture certain implants. And it's although rare, but yes, it can occur due to this reason as well. Then it could be due to systemic factors. For example, patient had a very good implant fixation done, but patient developed sepsis. This could lead to implant failure. Then this could be incorrect implant selection. For example, if you see this Philos plate was actually done for this patient, so probably patient developed later on sepsis and resulting loosening of the implant and eventually breaking of the screws. Similarly, if we are having a type 3 fracture of the intertrochanteric fracture or type 4 fracture, which is actually inherently unstable fracture, instead of using gamma nail or proximal femoral nail, we use DHS, although that will reduce the implant. But actually the DHS knot is a stable construct for that kind of unstable fracture. Therefore, this can lead to implant failure. And then actually the last is exposure to the repeated high stresses from incorrect implant positioning. Sometimes what happens is, despite all the effort, we are not able to correctly reduce the fracture fragments. And usually once this happens due to combination, or could be due to problems with the bone, or osteopenia or osteoporosis, then what happens is that certain areas there's increased stress, and this leads to screw breakage and eventually the implant loosening. So coming to the corrosion, what is corrosion? Is actually what happens is, on the top of the layer, then oxide layer formation, which actually damage to the passive layer. Passive layer is also actually a passivization, is a method in which oxide layer is formed on the metal to make it more inert. But once this layer starts to deteriorate, this oxygen goes in and touches the implant surface, leading to oxide formation, eventually leading to corrosion. This could be due to abrasive damage, as when the two surfaces articulate against each other. For example, in case of metal on poly, the polyethylene is articulating during the normal cyclic loading, leading to wear and tear or abrasive damage. This could be a minute surface cracks, which due to fatigue failure. And over the years, when the constantly repeated cycling of the loading and unloading occurs, this may produce cracks, and eventually during these cracks, oxygen can seep in and leading to corrosion. Or failure through crevice corrosion. Crevices are actually cracks which appear in the surface, and once they get oxidized, this leads to corrosion. This whole term is actually termed as crevice corrosion. And this could be simply a local inflammatory response. For example, we are using metals. There could be actually abrasion where can produce metal ions, and this can actually produce an allergic reaction. And this allergic reaction further contributes to metal fatigue and failure. Now coming to the friction and wear. Friction is not affected by area of the contact or the speed, but depends on the applied load. Ultra high molecular weight polyethylene is actually formed from the polyethylene by use of gamma radiation, and why it is done is actually it has a lower friction coefficient. What happens is, when this is used instead of metal on metal, actually it reduces the wear and tear properties, and therefore gives an implant a longer life. Metal wear particles could be problematic, because once, for example, if this was the case, if you're seeing this over here, this is actually using a femoral component over all poly rather than using a metal component. But when metal and metal component is used, they can result in abrasion, and usually metal losses or metal ions can be discharged into the blood. This can not only produce local inflammation, this can produce toxic or allergic reaction and implant loosening as well. And usually once this is uptaken by macrophages, then they produce a foreign body reaction to it as well, eventually leading to lymphocyte dominated vasculitis associated reaction and or scarring. So the important point is, a lubricating or modulator has to be used so that there is decreased friction and decreased actually discharge of metal ions from the metal, leading to decreased amount of reaction by the body. Other could be infection or malignancy. Infection could be, usually metal as such are inert as they are biocompatible, but they do not cause infection. But once infection actually seeps, usually through hematogenous spread via blood or via lymphogenous spread, usually via lymph nodes, once infection occurs, these, especially the Staph aureus, they are highly notorious organisms. They can go on the metal, they can form a biofilm, and this biofilm actually not helps to protect them and grow, but also makes eradication of infection impossible. So then once the biofilms are formed, usually then the only option is not only to eradicate infection, but take out the metal as well. You have to take out all the metal, because if you want to completely eradicate the infection over there. And as I told you, biofilm formation takes place, and then this impedes drainage, and eventually, or to actually remove the infection, you have to take out all the metal work. Then coming to the malignancy. Although it's few cases, but yes, they have been reported due to metal on metal bearing. This was actually mainly associated with the cobalt chromium alloy. Now coming to the ultra high molecular weight polyethylene. Now basically this is polyethylene was actually kind of used as a kind of a lubricant for the metal on metal to make surface from hard to harden soft surfaces. But the using of gamma radiation is actually used to make it an ultra high molecular weight polyethylene, which is actually has an excellent properties regarding friction and wear. Therefore, it does not wears off quickly. It's an inert thermoplastic polymer and used in orthopedics for hip, for example, in acetabular cup or in a knee in the tibial tray prosthesis. As you can appreciate it over here, and this is a total knee replacement, and there is a polyethylene insert just put above the tibial tray for a normal total knee replacement. Similarly, this poly can be used to put in the acetabular cup, so there is actually the femoral metal head articulates with the poly, not with the acetabular metal cup. It is sterilized by gamma radiation, as I just told you, promotes cross-linking of the polymer, which makes it high molecular weight polymer, therefore resist corrosion. The disadvantage is poor yield strength, susceptible for deformity and easily abraded. The problem is then obviously this is not that it does not undergo wear. Definitely some degree of wear and tear would take place, and sometimes you need to change the poly as well. Coming to the other materials, which although rarely utilized but actually are in experimental stage, and some centers are using them. These include silicone compounds. They are tough, flexible and inert, but the problem is they induce giant cell synovitis. So they are rarely used, but in certain situations they can be used as well, sometimes for the bone erosion and cyst. Now coming to the carbon compounds. Although carbon compounds have been found, but carbon fibers, they are actually used for external fixation devices, replace ligaments. For example, ACL, PCL ligaments can be replaced as well, but they usually have seen that they induce synovitis. Another carbon compounds include pyrocarbon. These are smooth implants with a negligible wear, but not for a larger implants. They can be used for some small implants such as knuckles and these areas in the hands and foot area. But usually the large implants have produced extensive synovitis, which could be damaging for the patient. Now coming to the acrylic cement. Polymethyl methacrylate cement is actually readily utilized all over the world, and it's basically an antibiotic impregnated, especially the heat stable antibiotic impregnated cement, which is readily being utilized in the knee and hip surgeries. Usually the primary surgery for the hip is cementless, but if cemented hip surgery is done, this is this acrylic cement which is readily utilized all over the world. Now coming to the hydroxyapatite. Hydroxyapatite is a form of a bone substitutes which are now coming up, which can be utilized to reproduce osteoinductive and osteoconductive properties of the bone cement, and usually can be plasma sprayed onto the implants. Now there is specific term which has actually been termed is that in vacuum, this plasma spray of hydroxyapatite is done onto basically the femoral stem, which gives it a more interesting properties, so that actually bone bonding of the femoral stem with the bone is actually more compatible and makes it more stable implant. And this results in rapid osseointegration. In this section, we briefly covered what are the different implant materials which can be utilized. Nowadays, TKR, THR have been readily performed. The most common materials include stainless steel, which is 316L. Then there is a cobalt chromium alloys, which have their own properties, but they have their own pros and cons. And the most other commonly alloy which has been used as the titanium alloys, which are mixed with other metals to form a titanium implant. Then although the stainless steel has its own pros and cons, it can be used in certain substances, for example when you want to give it a strength, but again it has its own fatigue problems and it quickly wears off. Cobalt and chrome is better that it does very stable and strong, but it actually cracks and gives a squeaking sound, which is usually seen in the hip, which is replaced by cobalt chromium alloy. Titanium, again, it's a very flexible implant. It gives a very good fit, but the problem is increased wear and tear rate. Introduction of polyethylene is to actually so that the metal and metal articulations can be prevented. But the problem is that polyethylene, although the use of gamma radiation has been converted to ultra high molecular polyethylene, but still it can undergo wear and tear, and sometimes you need to change the poly before change of the whole of the implant. Thank you very much. Keep watching sqadia.com.